ml. And then in case of traumatic TAP, there will be visual decrease of color. So this is going to be tube 1, tube 2, tube 3, and tube 4. So that's why tube 1 cannot go to the hematology department, because for that contribution of color may not be from your infection, may not be your trauma inside any bleeding or anything. It may be due to the traumatic TAP of the sample. So, but if there is a real trauma, if there is internal hemorrhage, all tubes are going to be red, depending upon the hemorrhage. So that's why I said the traumatic TAP, there is a visual decrease of colors, decrease in the presence of RBCs, because when you are going in, you are getting something, but when you are inside the fluid, there is nothing. So that's why it's getting decreased, versus a consistent color, presence of RBCs through all 4 collected tubes like this one. This is really some trauma happened in the brain or cerebrum or spinal. This demonstrates the blood is not present in CSF, rather it is due to the trauma of the TAP. This is why, see what I told you, this is why tube, so my knowledge is okay. So this is why tube 1 is never sent to the hematology department. Let me just drink some water. A second. So cerebrospinal fluid, red and white blood cell counts usually performs using automated instrument. Normally, there will be no RBCs, but may be present from the lumbar puncture, that is the traumatic lumbar trap. Normal WBCs counts is 0. Generally, there is nothing, but it can be present 0 to 8 into 10 to the power 9 per liter. We are collecting only 4 ml. So there is a chance there will be nothing in normal, or maybe 1 or 2. In case WBC's count can be observed in infectious disease such as meningitis and non-infectious conditions such as trauma. Or multiple sclerosis. Leukemic patient, the cancer, who have a normal white blood cell count but have immature blood cells present in the CSF. You know, that is the immature blood cells. Yeah, sorry. Yeah.
If you had red blood cells, like blood intentionally put into, I guess, the spinal column where the cerebral spinal fluid is, what happens to those blood cells? Do they just disappear after time?
You are going to put the blood cells inside or what? What is the question, Kara?
Yes. Yeah, like I had that done after I had my son because the anesthesiologist went too far with the needle and punctured.
Yeah.
So I was leaking my CSF
Yes.
and my brain was swelling. So
Yeah.
10 days later, they put a big, large syringe full of my own blood. They gave me another epidural and squirted all my blood in there to make plugs for the holes.
Oh, I didn't know that, Kara.
Yeah.
I didn't know
So I was
that.
just wondering, like, what
Oh,
happens to them? Do they just disappear?
I think anyway, WBC is going to be, die after 120 days.
Okay.
Yeah. Yeah, and WBCs is going to slowly is going to be decayed or absorbed, or they slicked out. Once the job is done, they are slicked out and go to the WBCs can move, right? Diabetes, whatever I know, and they can go,
Yes.
yeah, through the tissues and
Okay.
yeah. But I never heard this one that they can put that blood. I will search for that. Thank you for letting me know. I will do that. I never gone through. I had my lumbar puncture 199 times because doctors was failed to do that, but I have no idea. I had total loss of cognition, memory, and everything due to the lumbar puncture, faulty lumbar puncture. But
Yes.
yeah, yeah, I had that. I total loss of memory and everything. From I had the viral meningitis, and then one night they tried to do the 9 times lumbar puncture, so it was so much pain and so
Same.
cognition and other things. There is a lot of problems, but touch wood, I didn't have to have that going through that one that they have to put the blood in through the CSF. This
Through
is
the
I heard
epidural.
first.
Yeah.
Yeah, yeah. I never heard that one. Yeah, thanks for letting me know. So many things happen to people, right? So
Yes.
yes, yes. Thank you. I will look that one. But what they do, why they do. Obviously, that means that no CSF, the puncture they made so bad, whatever I think,
Yeah.
because they cannot get repaired, right? So
Yeah.
nowadays, probably they will put you more platelet type of things for the because they can only make the plaque formation. I have no idea about that. I am not an expert at CSF. Yes. Oh yeah. Thank you. Thank you.
No problem.
Yeah. Leukemic patient have a normal white blood cells count but had immature blood cells because that is showing that there are going to be more production of WBCs because mainly the blood cells is produced in the bone marrow. Cytocentrifugation. What is cyto? Means cell centrifugation. So what they use a special centrifuge is needed. It is a slow centrifugation method provides better cell yield and morphologic preservation compared than ordinary centrifugation because we are getting very less amount of cells. So we have to be very specific so that we can use a very special which is going to be slow but it can preserve the actual structure of the cells. What is the technique? You have to take 0.5 ml of the specimen with few drops of bovine serum albumin to preserve cellular or morphology. What is bovine? Is when it's coming from the cow family, is called the bovine. Cow, buffalo, all these things is called the bovine. You doesn't need to know this one because this question is not going to come. Just to let you know, you are going to take 0.5 ml of specimen, then you are going to add couple of drops of BSA. So that BSA is going to give you the again kind of cushioning support so that it doesn't, the cells can avoid any friction to preserve cellular morphology. It's a solution, it's not a cell, right? Albumin is a protein. So albumin you are putting from outside albumin solution as a coating so that the cells can stay in good structure, morphology. Sample is slowly centrifuge, all the fluid portion absorbed into a filter paper, and all the cells are concentrated on a microscopic slide. Stain with right or variety of stains for hematologic or cytologic studies. You learn you did the right stain, right? WBC stain, you know. You did that, right?
Yes, ma'am.
Yes,
Yeah,
yes, we did.
yeah, yeah. So basically, this is the centrifuge. This is a holder. This is the slide, filter card. So when you are going to put it, the cells are going to be concentrated and fluid is going to go out. So this is the structure march. You doesn't need to know that one, but just is go through like that. Funnel from the filter card it goes to the slide, from the slide clip, and then it can go to C. So smears from centrifuge spinal fluid. If a cytocentrifuge is not available, CSF can be prepared by use of a regular centrifuge. Okay. The supernatant is removed and the sediment is used to prepare smears on the glass slide. How you did other smearing. Dry and wet right stain. So you are going to put the cells there, you have to dry the slides, and then you can do the right stain. So using the technique, cells have tendency to distorted or damaged. Only that is the disadvantage. Other concentration techniques, more time consuming, expensive, only available in larger hospitals. Okay. Morphological examination. What they looks? Predominance of polynuclear cells indicates a bacterial infection. Presence of many mononuclear cells, that's a lymphocytes, indicates a viral. You know, viral. Any viral infection is come the lymphocytes. Predominance of polynuclear cells, mainly what is the neutrophils, right? What is the polynuclear white BC?
Yes,
It has
ma'am.
different, yes,
Neutrophils,
indicates
the
a
granules.
bacterial, yeah,
Yeah.
bacterial infection. What they mainly check? They check for the protein, which increase in the meningitis, hemorrhage, multiple sclerosis. When low, when there is a fluid leakage because of blood-brain barrier damage. Glucose should be measured immediately. Reduced in metastatic tumor, insulin shock, bacterial meningitis, but not in viral meningitis. So that's where they differentiate along with the cytology, whether there's a bacterial meningitis or is a viral meningitis. In the viral meningitis, glucose concentration will be same, no change. But the bacterial meningitis, bacteria is going to use the glucose to multiply. So reduced glucose concentration, primary brain tumor or vascular accident. Elevated in diabetic coma, lactate used in the diagnosis and management of meningitis. It also increased in oxygen deprivation. So these are the parameters they generally have to check immediately, and these are mainly related to the brain problem. And mainly we do the meningitis bacterial or viral. Okay, so what are the, these are also biomarkers for the Alzheimer disease. It's called the amyloid beta. These questions will not come, but from the cerebral spinal fluid, you can see if there is a protein called amyloid beta is getting present. If there is more and more present, it's going to make the some kind of, it's going to be difficult to tell me, some kind of knot of things in the brain, so that you can in the, you are losing some memory or cognition. Microbiological examination. This is a biomarker for Alzheimer disease. This is also important to know. So from the CSF, you can do check the biomarker for Alzheimer. Yeah. For the microbiological examination, gum stain and culture, we are going to learn this one when we are going to do the microbiology. Gram stain and culture for the bacterial and viral. Gram stain is most useful in diagnosis of acute bacterial meningitis, because that is mainly stain the bacteria, not the virus. So that means if there is no staining, but still is showing some importance in the glucose, so it's a combination. That's why you need to do the 4 tube collections. And from the 4 different tubes data, doctors can conclude whether it's a bacterial meningitis or the viral meningitis, or it's from the trauma or something. So acid first stand for tuberculosis and India link preparation for Cryptococcus infection. Cryptococcus infection. It can also do the syphilis. Virial test is also known for serological test for syphilis, but only for syphilis nobody does the CSF. You can do in the blood test. Now, serous fluid. What is serous fluid? Pericardial fluid surrounds the heart. Pleural fluid located with the layers of pleura. Peritoneal fluid in the peritoneal cavity, space between the walls of the abdomen and the organ inside. The fluid is formed continuously in the body cavities and reabsorbed, leaving only very small volume through the lymphatic system and the capillaries. Yes, normal appearance is pale and yellow colored. Increased volume of this fluid is called effusion. What types of diffusion? Exudates, transudates. Exudates are fluids, cells, or other cellular substances that are slowly discharged from the blood vessels, usually from the inflamed tissue. So it is releasing from the blood vessels. Fluid buildup caused by tissue leakage due to inflammation of local cellular damage, and transudase are fluid that pass through a membrane or squeeze through the tissue or into the extracellular space of the tissue. So it is leakage from the blood vessel is exudates, and transudates when is getting inside, passing through the inside the tissue. That is the transudates. So it's fluid buildup caused by systematic conditions that alter the pressure in the blood vessels, causing fluid to leave the vascular system. It doesn't need to know. Just remember, exudates is leaking from the blood cells, discharge from the blood vessels, and transudase, when fluid are passing through, it's getting inside through the tissue to the extracellular place of the tissue. Serous fluid, and this is called the effusion method. So transudates effusion, systematic disorder disrupt filtration and reabsorption. When it happened, cognitive, heart failure, liver dysfunction, nephrotic syndrome. What is nephrotic syndrome means?
Scarring of the kidney, ma'am.
Kidney, any problem in the kidney. Yes, damaging the kidney. And peritoneal dialysis. When people has to do the peritoneal dialysis, sometimes it happens because it's get out. Exudative infusion affecting membranes, that is inflammation, infection, malignancy. So that can cause the leakage of the fluid from the blood vessels. Differentiation of the effusion is important for further testing. Transudates little further testing. Forget. To be honest with you, nothing is going to come. It's going to be too much for you guys. Transudates effusions. Appearance watery, clear, pale yellow, no clots. White cell count low in general in CSF. Red cell count low unless trauma. Total protein less than 3 grams per deciliter. Lactate dehydrogenase low. Glucose varies with serum level, how much serum is present. Exudates, appearance cloudy, turbid, purulent, or bloody, may clot because it's going to be inside the tissue, right? Yeah. Sorry, it's bloody because it's coming from the blood vessels, and transudates is getting inside the tissue. Okay. White cell counts 500 to 100,000 cells per milliliter. It's a lot per ml, 500 to 1,000 cells for the exudate. Red cell count greater than 100,000 cells per ml. You just don't need to remember. I'm telling you, I have to tell you, so I'm just telling you this total protein more than 3 grams per deciliter. Lactate dehydrogenase is increased greater than 60% of serum level, and glucose is lower than serum level here. So this is the comparison between transudates versus exudates. It's hard to remember, good to know. Now, pleural fluid is surrounds the lungs mainly and lines of the thoracic cavity. That is the pleura area, right? Lungs and thoracic cavity. Its appearance is generally, you have to remember what is the pleural fluid, what is the pericardial fluid, what is the peritoneal fluid, what is the synovial fluid. You just need to know all the details of this one for the exam, but for your knowledge is always good to know. Its appearance normal, clear, pale yellow. When presence of WBC, inflammation, infection. It may be turbid, normal, about 1 to 10 millimeters of pleural fluid is moisturizing the pleural spaces. Yes, is getting the also moisture and the cushioning. In inflammation occurs, plasma protein level falls, congestive heart failure is present, or lymphatic drainage decreases. So that means the fluid cannot get absorbed to the lymphatic systems to return back to the actual blood. So there can be an abnormal accumulation of pleural fluid. So this is the pleural fluid. It's decreased in rheumatoid inflammation, decrease in purulent infection. I don't know what is purulent infection. Lactate elevated in bacterial infection, triglyceride elevated in chylous effusions. I have no idea. So you guys can read this one. It's not going to come. Then is pericardial fluid. One of the, what are the, you have to remember what are the three different types of serous fluid. Who is the serous fluid, which is not. Pericardial fluid is also normal, clear, pale yellow. When there is an infection, there will be or malignancy. They may feel turbid. Accidental puncture can cause bloody. When they are doing the collecting the fluid to check anything, so that time accidental puncture of the blood vessels can cause it bloody like the CSF. The pericardial space enclosing the heart normally contains about 25 to 50 milliliters ultrafiltrated of plasma called pericardial fluid. So it's the plasma which is coming out from the blood vessels and is surrounding the heart and the thorax. Okay, so that is only 25 to 50 ml is nothing, but is helping a lot. Forms continually and reabsorbed by the nearby lymph vessels. The lymphatic system is coming from the limbs and blood vessels and then is getting reabsorbed from the lymphatic system. When an abnormal accumulation of pericardial fluid occurs, it fills up the space around the heart and mechanically inhibits its normal action because heart cannot expand and that much if there is too much fluid because the pressure from outside. So then maybe you are going to feel difficulty in the breathing. If you cannot breathe properly, then you are going to feel problem in the SOB, and obviously heart cannot function means there will be consequences. You are going to face fatigue, dizziness, weakness, and finally, if it is too much accumulation, heart cannot function properly. So significance, pericardial fluid. So it can see normal transient when the blood is coming infection or malignancy, grossly blood, cardiac puncture, anticoagulants. Milky, this is the disease, chylous and pseudochylous material. I never. Differential, when there is increased neutrophils, bacterial endocarditis. If there is a malignant cell, you can check it. Metastatic carcinoma, seeing all the cells through the cytology. Embryogenic antigen, you can test it, that is a chemically. Metastatic carcinoma, Gram stain and culture for bacterial endocarditis to make sure that is the same thing. We are going to see increased neutrophils, that is the WBC, which is going to make it turbid, and also you can see it in kind of bacterial endocarditis by Gram stain and culture. Acid fast stain, that is the tubercular diffusion. You are going to learn when there is the tuberculosis, you have to do the acid fast stain to make sure whether there is a presence of infection or not, meningitis. Adenosine deaminase, that is the tubercular effusion. So peritoneal fluid is less than 100 milliliter of clear straw colored peritoneal fluid is present. Peritoneal is near the abdomen and pelvic cavities. An abnormal accumulation of peritoneal fluid is indicated by severe abdominal pain and may be caused by a ruptured abdominal organ, hemorrhage resulting from trauma, postoperative complications, or an unknown condition. So it generally fluids except which is coming from the exudates from the blood, all are generally clear or pale yellow. Again, turbid when there is a presence of bacterial or fungal infection. Green brown color. If there is a leakage of bile, the bile is little bit greenish color. Even when you are in starved condition, you are throwing up, sometimes you get the green vomit. So that is from the bile. So if there is in a bile color, it can be changed to a little bit green because it's the peritoneal area. Milky trauma and lymphatic blockage. WBC counts is normal, 350 cells per microliter. Absolute neutrophil counts is more than 50% of total WBC count or greater than 250 cells when there is an infection. Obviously, there will be in case of WBC count. Lymphocytes elevated in TB. Serous fluid collection. How we are going to collect it? Aspirate by a physician under strictly antiseptic condition. May be diagnostic or for mechanical reasons to prevent excess fluid from inhibiting actions of the lungs or heart. So they can collect only for the diagnostic or some reasons, and so that they can take out the fluid, excess fluid, to help in the proper functioning of the lungs or heart, or inhibiting actions of the lungs or heart which is causing problem. At least 3 anticoagulant tubes of field are generally collected and used. What type of EDTA? Gross tube for gross appearance, cell counts, morphology and differential. Suitably anticoagulate tubes such as heparin for chemical analysis. An example of the heparin?
Lithium heparin or
Yep.
potassium heparin.
Potassium heparin.
Sodium heparin. Yes, or sodium heparin.
Sodium heparin tube color?
Green.
Dark green.
Dark green. Lithium heparin is mint green. Okay.
Mint
Yes.
green.
Yes.
Good. So, and sterile heparinized tube for gram stain and culture. Any sterile, it doesn't need to be any anticoagulant, sterile containers. Additional tubes of the entire collection with a preservative are collected for a cryocytologic examination for tumor cells. So they are going to tell you, they are going to give you, you have to collect from the cytology. So routine examination, you do the gross appearance, normal cerebral straw in color, we already told. If there is a color seen, it's a transudate. If there is any blood leak or something, if there is a turbidity, increase in the number of cells. Abnormal color, fluid may appear milky, cloudy, or bloody, or gross observation. A cloudy fluid often associated with the inflammatory reaction for the bacteria or cell or viral. So if there is a bacteria or virus, there is a chance that there will be always kind of turbid or abnormal color. Clotting. Specimen must be collected in the plain tubes. The fluid clot indicates substantial inflammatory reaction. So you are going to collect, that's why you need to collect couple of different types of tubes. And then it's going to be wrote in the giving instruction in the requisition. Generally, we don't collect it. Nurse has to, doctor has to collect it, and nurse has to make label and everything. But in case you need to, you know how to label. For CSA, we have to take the four tubes for sure, but the others at first the need of the doctor requisition. Red and white blood cells counts. Cells counts are done on well mixed anticoagulated serous fluid. WBCs count greater than 500 cells. You doesn't need to know all these things. Yeah, for morphologic examination to see the cells, cytocertification is better to make a spear so that you can keep the cells in its condition, how it is coming in the infection or the normal state without changing any morphology. Microbiological examination for any type of bacterial confirmation we use the gram stain. We are going to learn it, what is the gram stain, how it does later. Chemical analysis, obviously we are going to check the protein, or the most important things. Couple proteins is measured in the fluid and in the plasma. The level in the ratio are helpful in distinguishing an extruded from transudate. Forget it. You can see the protein if there's a higher or lower. Lactate dehydrogenase measured in the fluid in the plasma. Increased LDH are caused by cellular debris from infection or malignancies. And glucose is measured in the fluid, and in low blood glucose could be due to bacterial infection. Bacteria use glucose as a metabolic substance, which I told you before. So virus generally doesn't use your glucose, but the bacteria use your glucose and cause the glucose low in your blood and body, because they use the glucose as their source of energy for them to multiply and cause more damage to the body. Other test, determination of amylase, lipase, ammonia, lipid, or other enzymes. Let me see which number slide we are. 41. So you guys can go for break, come back, and then we'll complete the rest, okay?
Yes, ma'am. Thank you.
Okay.
Miss Momo.
Thank you.
Thank you, Miss.
Okay.
Miss
Some,
Momo.
yes, who is that?
It's Rudyard. So my internet was giving me issues. So it's now that I'm logging in.
Yeah, I didn't get any message from you, so I was thinking what happened. I called your
My
name.
my
Okay, so
internet was giving me issues. So now that
now
I
you
log
can
in.
hear it.
Yeah, yeah.
Okay, so I'll make you present now. Okay.
All right, thank you, thank you.
Okay. Yeah, just like to declare you one thing. Majority of you got very, very good marks, but Yusra got 100%. Congratulate her.
Congratulations.
Thank you.
Congratulations, Yusra.
Thank you.
Another student of the month. Woohoo.
Mm-hmm.
Thank you very much, everyone. Thank you, Ms. Maman.
Thank you. A majority of you did very good. I saw a lot of over 90%. Even who when they came to my marks, it was 70%, 72%, then it became 94%, 90%, 92%. You know that. Good job.
Thank you, Miss.
Okay, go for break.
Okay, thank you, Mom.
Hmm. Okay, guys, come back on the video. Ah, দরজা কে খুলে দিল? Yes, Santiago. One is missing. Who is not here anymore? Oof. Oh, so who told that it's going to be Binas? But Binas told she is going to be online. Okay. Okay, now we have learned about the other three fluids. Now we are going to do the synovial fluid. So synovial fluid, we already know, is in the joints. Arthrocentosis constitutes a liquid biopsy of the joint. When you have to check the joint biopsy, or sometimes you have to take out the fluid deposition, mainly in the joints, in the knees or any areas, they use the process, is the puncture, right? So go and take the fluid. So why is used? Analysis of synovial fluid provides information about different kinds of joint diseases. Normal synovial fluid is an ultrafiltrated plasma because there is until there is a wear or tear or the blood vessel is damaged, it's the plasma mainly getting out from the blood with addition of hyaluronate or hyaluronic acid, a high molecular weight mucopolysaccharide, because this helps only, this is the thing. What is the difference? Synovial fluid is different from any other series and spinal fluid. It contains the hyaluronic acid. That's why you saw when there is a joint pain and arthritis, they give some medication supplements hyaluronic acid. What is that? Hyaluronic acid is responsible for the normal viscosity of the fluid, which serves as the lubricant. It's highly viscous and it helps to lubricate the joints so that it can move freely. So in arthritis, we just get the leakage and sometimes damage. So there is a less of hyaluronic acid, less production of synovial fluid, it's become dry and it's giving you more pain because cushioning or lubrication is gone. So what is the difference between the synovial fluid and the other body fluids, the CSF or any serous fluid? The synovial fluid contains the hyaluronic acid. And hyaluronic acid helps to lubricate the joint. So where you can see the hyaluronic acid, syringe goes here in between. This is the cartilage. The synovial fluid is there. So doctors can go from here, this side, and take the fluid out. So it's normal straw color synovial fluid. When there is arthropathy, it became more darker. I don't know what is crystal arthropathy, is more darker. And when is a sepsis, Arthritis means infection in that area. The color is going towards the black, not total black, but very, very towards the black. So normal synovial fluid is straw color and viscous. It's not clear. You can see all other body fluids are mainly clear. This is not clear. This is called viscous due to the presence of hyaluronic acid, which acts as the lubricant so that the joints can move freely. So normal synovial fluid, straw colored and viscous. White blood cells is low. You doesn't know to Asbestian crystals are normally absent, and the fluid is sterile. Obviously, all these body fluids are sterile. Normal synovial fluid has about same chemical composition as plasma without the larger protein molecules, which you have the large protein molecules, yes, hyaluronic acid. So aspiration and analysis, synovial fluid differs from other body fluids because importance of finding crystals in the specimen because of normally is highly viscous and you have the hyaluronic acid. So rationale for the aspiration, determine the cause of joint disease, crystal included, any crystal deposition, degenerative, inflammatory or infection. So morphologic analysis means the cell structure, cells and crystals together with gram stain and culture, to check whether there is infection of the bacterial helps differentiation. For effusion, unknown etiology, for pain or decreased joint mobility, obviously. So what is happening in the joint? So classification of synovial fluid at the joint disease, which is non-inflammatory fluid, which is seen in osteoarthritis and traumatic arthritis. Inflammatory fluids is called the inflammation. It's the rheumatoid arthritis and lupus arthritis. Rheumatoid arthritis is an autoimmune disease. Infectious fluid suggested a bacterial infection. If you have any damage, you have a cut, something, it goes inside, and especially it happens mostly after the knee surgery if it is not taken properly or during the surgery if there is any chance there is any infection goes there. Crystal induced, crystal is the gouty, okay. Crystal induced fluid when there is a gout, you can see the crystal. Hemorrhagic fluid, that is an hemorrhage at the joint, tumor or traumatic injury such as fractures or hemophilia. Synovial fluid collection of should be divided into three parts. Sterile tube for microbiological examination, tube with liquid EDTA preferred or sodium heparin for microscopic examination, and plain tube without anticoagulant for any clot formation, gross appearance, and the chemical and immunological procedures. So it's tube 2, tube 3. So one has going to be your first one, which is for the microbiology as usual, aseptic one, sterile containers. Tube 2 for the chemistry tube, which is without anticoagulant, and third, as the following the order of draw, third is going to be the EDTA or heparin tube from the microscopy so that you can see the cells. Routine examination of the synovial fluid, gross appearance, viscosity, if there is a presence of red and white blood cells, and then you are going to cytocentrifuge so that because the cells are less, right? Cytocentrifuge like the CSF and other serous fluid like the all the serous fluid. So you are going to cytocentrifuge so that you precipitate down, sediment the cells, and then you are going to do the WBC differential on the slide. And also if there is any presence of any crystal to check whether you have the gout. So microbiology, how you do that? Microbiology means checking the bacteria, gram stain, culturing for bacteria or myobacterial or fungal infection. Chemistry test, you can check for the glucose, protein, and other tests. Again, these three parameters are very important for all the fluids. You can see it is coming repeatedly, glucose, protein, and lactate dehydrogenase. In addition, here we are doing the uric acid and some lactate determinations because uric acid, if there is any, this is cause pain, if there is any deposition of any fluid, what is called crystals. Glucose level is low than the serum until there is an infection. Protein increase in several conditions like the rheumatoid arthritis, gout, infectious arthritis. So in general, it's become high when there is an infection. Seminal fluid. What is the seminal fluid? What will you store? Do you remember what is the sperm first produced? Sperm
Yes,
developed
ma'am.
in the testicles within a system of tiny tubules called seminiferous tubule. It comes from there, the name seminal fluid, because sperm needs some fluid to pass, to float. So that is the fluid where the sperm floats. So that is called the seminal fluid. So sperm develops in the testicles within a system of tiny tubules called the seminiferous tubules. So you have seen this one before. This one, seminiferous tubule is getting like this very coiled structure, and it is produced here in the testicles. Okay. And they are going to show you later. This is it's a highly viscous. When you spin down, you can see the difference. Okay. Semen analysis, magnetic resonance spectroscopy. Semen analysis is done in the fresh measurement is needed, and it should be analyzed within 30 minutes of collection, or you have to keep it 37 degrees Celsius to examine within 1 to 2 hours of collection. Upon standing, motility of the sperm significantly reduced. You have to collect in proper transport and prompt examination as critical factors in the analysis of a seminal fluid. How traditional semen analysis is done? It is recommended 3 to 5 days before of sexual abstinence before collection. You have to abstain from the sexual activity 3 to 5 days before your collection. Use of condom should be avoided. You cannot do that. So patient must be advised to keep the specimen warm if collected at home and deliver promptly to the laboratory. Otherwise, semen, the sperms is going to be inactive. Reasons for analysis: assessment of fertility or infertility, some forensic purpose, determination of the effectiveness of the vasectomy, whether the vasectomy is done properly. If there is a vasectomy, are you going to see sperm in the semen?
No, ma'am.
Okay.
No.
So vasectomy and the determination of the suitability of a semen for artificial insemination procedure, whether sometimes we are doing the in vitro fertilization, so that whether the semen, when the sperm are collected, whether the seminal fluid is very good for the artificial insemination. Okay. Sperm count. Also, reference range of sperm count is 20 to 160 million per ml. So mainly used for the infertility problem, sometimes the forensic, and also to check whether the vasectomy has been successfully done or not. Macroscopic examination includes time for complete liquefaction, appearance, volume, viscosity, and pH. Weight mount analysis. So you have to do the weight mount, means that it's not going to be dry on the slide, it's going to be wet so that you can see the sperm and the motility. Observation of agglutination, viability, counting chamber, you doesn't need the sperm morphology, can be checked with the hematoxylin using stent smear to check. So you have to mainly know why is used for and from where it is produced and what is its function. So amniotic fluid, everybody knows amnion is nourishing and protecting liquid content by the amnion of a pregnant woman. So it's a clear fluid, sometimes yellow little bit, mostly water, but contains proteins, carbohydrates, lipids, phospholipid, urea, electrolytes, everything. Fetal cells in the amniotic fluid can be examined for genetic defects. From the amniotic fluid, they aspirate and then check if there is any genetic defects, and chemical analysis such fibronectin and other assays can determine fetal lung maturity, how it's maturing. So syringe goes, fluid take out from here. This is the amniotic cavity. baby is there. Take the fluid and for use for taste. Oh, we forgot there is another fluid in our body. It's a saliva, right? That is also fluid. It doesn't stay like a fluid, but it's a fluidy things. When you are too hungry or you see very good food, saliva comes out, right? Yeah. Especially you can the animals when you are giving them treat, you can see how much saliva they are producing. So saliva is a clear, alkaline, viscous fluid secreted by the mucous glands of the mouth and used for various analysis. What saliva does?
It helps also in the digestion of food, ma'am.
This is the first,
Just the same
the first place where first the digestion start. But the mainly
Yeah.
what type of digestion takes place there?
It's like because there's an enzyme called the salivary amylase.
Yes,
It
starch.
helps with yes, ma'am.
Starch. Very good. Very good. Very good. Everybody should answer how Evelyn is participating everything. Probably that's why she got the student of the month. Okay, so everybody that's it that they watch. Saliva may be tested. Okay, so saliva, we said clear, alkaline, and viscous fluid secreted by mucous glands of the mouth used for various analysis. Microbial studies of viruses and bacteria are chemical testing of hormones. Different types of, you can check the virus, bacteria, and if there is a change in the hormone, therapeutic drugs and drugs abuse can be performed on the saliva. Saliva may be tested in the blood bank to detect secretors of certain antigens. This one I didn't know. Oh, okay. The most common way for collecting a specimen to have a patient chew on a wax or absorbent dental cotton for several minutes and then collect the saliva. You give the chew on a wax or absorbent dental cotton, they are going to chew it. The saliva is going to on the soaked, that cotton or the wax is going to be soaked with the saliva. Then you are going to take it out, then you squeeze it and take out the saliva. Then HCG is a human chorionic gonadotropin hormone. Everybody knows it's known as the pregnancy test. Test for beta unit. That's why it's called the beta HCG, which is actually the pregnancy hormone. Helpful in monitoring high risk of pregnancy. Can be used as a tumor marker for certain cancer. More will be covered under chemistry module. Okay. This hormone appears in the blood and urine of pregnant women as early as 10 days after conception. So if you are thinking I miss the period in 1 day, 2 days, within 1 week, whatever is going to come, you cannot detect it either in the dipstick stage or even its level is going to be too low even you do the blood test. So you can measure or detect the beta HCG presence either by dipstick study. What is the method? What is the basis of the dipstick? Not this. Oh my God! It's not the dipstick. What is called? What's not the dipstick? Card device. Device. What is the basic principle in the device? I told you in the class. How we detect the beta HCG hormone? What is the mechanism or the principle of the test?
Negative.
Immunoaffinity.
Immunoassay.
Immunoaffinity, not acid. Immunoaffinity.
Affinity.
EPT chromatography. Yes. Yeah. Immunoaffinity chromatography. Okay. So test performed too early in pregnancy may yield false negative results. So if you feel you are pregnant, you can check it by 3 days, 4 days, 5 days, but it's better to check after 10 days and repeat 2-3 times to make sure. Or you can go to the doctor also to check it. Yes. The test performed, okay, hemolysis of blood may interfere with the test results. So you have to be careful that it's not going to be um, especially when you are with the device. Urine specimen should be collected as the first voided urine. It has been again they are repeating because why morning urine is important for collecting beta HCG like a lot of other things. Why is it important for
It's
beta HCG also?
concentrated.
More
It's
concentrated.
very
More
concentrated, more
concentrated.
Very
concentrated. So you can
concentrated.
yeah, Yeah, so even if you have a little bit straight amount, say the 10 days or 11 days is giving the appearance of the beta ECG. When you are doing the normal urine, it may dilute it. But in the morning urine, what is the time frame for making the morning urine? You cannot pee. Hmm?
So what's the question again?
How long you cannot pee before, say for example, collecting the morning urine?
8 hours.
8 hours. 8 hours. 8 hours. Okay. So beta ECG can be also checked in the urine, and also it can be in previous method it can be checked in the SST tube, but nowadays you can do it in the mean tube. So two different ways of ECG can report it: qualitative and quantitative. Qualitative is on the card or device, or what you do the test, right? Give a positive or negative result depending on the presence or absence of the ECG in the sample. You did in the device, right? Okay. Can be done using either blood or urine sample, mostly the urine, most often to confirm a pregnancy. Quantitative measures the amount of HCG present in the blood, can also use the part of diagnosis of abnormal pregnancies other than health conditions related to pregnancy that can rise the HCG level. Sometimes it happens you cannot you conceive it, but you cannot keep the pregnancy because beta HCG level hormone it should be increase. But sometimes your body cannot keep that high level, so that time pregnancy falls. You do the miscarriage. So those type of things you have to monitor the beta HCG presence. And also, can you tell me when, except the female for the pregnancy, what is the another one we used the HCG to check?
It's the cassette
The
method,
strip.
no?
Prostate
Strip.
cancer. Only
Yeah.
men when you
Strip.
are going to do the beta HCG test to check if there's chance of prostate cancer.
Oh, yes, that's true, ma'am.
Okay. So we
Yes,
did
ma'am.
the pregnancy test by strip or cassette. It's a rapid chromatographic immunoassay that's called the immunochromatography. For the qualitative, it's not quantitative. It can tell you whether the presence of beta ECG or not. It cannot tell you how much beta ECG is there. That is, you need the chemical analysis blood test. Detection of ECG in urine or serum to aid the early detection of pregnancy. These pregnancy tests are specifically designed for professional users like the doctor's clinics for determination of early pregnancy, but have also found a place in home pregnancy testing application due to easy of use and low cost. Specificity is 98%, meaning the test is highly selective for HCG glycoprotein. So it depends upon how much specific the test result can give you. The test uses two lines of indicate results that you guys already had. One is a control and one is a test window. So immersing the test tube in urine or serum specimen and observing the formation of colored lines. Sorry. We never use the strip, but in the strip you can tell only there is no control test. So you can just tell whether positive or not. If it's a positive result in the strip, it's positive. If there is no line, it's negative. But in the cassette or device, you can see the strip it working as not. So you can get a control and then the test window. So remove the test strip from the seal pouch, that is the device, and use it as soon as possible. With arrows pointing towards the urine or serum specimen, immerse the test strip vertically in the urine or specimen. Do not pass the maximum line, that is the test strip. You guys know, place the test strip on a non-absorbent flat surface, start the timer and wait for the colored lines to appear. Okay, MLT read and interpret the result. So advantages of using blood test: can detect a pregnancy earlier than a urine test at about the 3 to 10 days. So blood test can give you, because it's more concentrated there and its hormone is secreting in the blood first. Any hormone is secreting in the blood first, then it's going to be transported in the specific organ. So 3 to 10 days from possible conception. But if a negative result is received, a test should be repeated if a period is missed. So it's not like that by 3 to 10 days is 100%. If you are not getting any HCG, that means, and you are having the all symptoms of pregnancy, it doesn't mean that you are not pregnant. So you have to retest it after 10 days. And then you can make sure. Can measure the concentration of HCG hormone in blood, useful information for healthcare provider in tracking certain problems in pregnancy. Disadvantages of using a blood test: more expensive than urine test, takes longer to get results, must be done in a clinical laboratory. How are you going to storage the body fluid? Any kind of body fluid is considered as biohazard. Refrigerated, most of the body fluids require refrigeration unless otherwise specified. Like the semen, you cannot put in the refrigeration. You have to put it in the room temperature. Microbiological samples you can keep in the room temperature. So follow the lab SOPs for proper storage of the fluid. Retention period of the body fluids varied from 48 hours to 7 days, depending upon the type of specimen. So even you run the sample, you have to say 48 hours to 7 days, and you have to follow what is your lab rule or where you are working. Disposal. The disposal of body fluids shall be contained in disposable plastic bags or container that are tear resistant, leak proof, and secure to prevent leakage or expulsion of solid or liquid waste during the storage, handling, or transport. Biohazard waste containers shall be clearly marked with the universal biohazard symbol, permanently displayed on label biohazard waste and seal, except the urine. If you doesn't have the routine random urine, if there is no chance that there is going to be that much infection, only you can waste in the toilet or sink. All other body fluids should be considered as biohazard and has been disposed of following the biohazard principles. Done. Let me see what is the next one. Oh, we have more. It's downloading. Oh my God. What we have to learn more? It looks like it is the same PowerPoint. Give me a second. Hello?
Yes, Miss, it's the same, it looks like.
What, Asnet?
I said it's the same PowerPoint.
Yeah,
Yes,
they put
ma'am.
it the duplicate time. That's why it's taking. So this is the collection guideline for specimen labeling, handling, transportation related to your body fluid. We have already discussed, but these are more details. We have gone through each type of collection, right? How we are going to collect the CSA, how we are going to collect the spinal, what is called synovial fluid. So you know now.
Cerebrospinal fluid is also abbreviated as CSF, and
You
it's
guys
a
can hear
colorless
it?
liquid which has a
Hear
purpose
it?
to protect
Yes,
the
Yes,
brain
ma'am.
and
Okay.
spinal
Thank you.
cord
Yes,
from
ma'am.
physical and
Okay.
chemical damage. It circulates through the ventricles of the brain, the subarachnoid space, and the central canal of the spinal cord. Cerebrospinal fluid is actually part of extracellular fluid, and it contains various substances which are both organic and inorganic. It contains glucose, lactic acid, proteins, urea, and positively charged ions like sodium, potassium, magnesium, and calcium. It also contains negatively charged ions like chloride and bicarbonate. An important thing to note is that cerebrospinal fluid also contains lymphocytes. The total volume of cerebrospinal fluid in a healthy adult is between 80 to 150 milliliters. There are three main functions of cerebrospinal fluid, and the first one is to provide a suitable chemical environment for neuronal signaling. The balance of positive and negatively charged ions helps with the production of action potentials and postsynaptic potentials. If this balance is disrupted, it can seriously disrupt the production of these nerve potentials. It also has a function as a shock-absorbing medium. It helps to protect the delicate tissues of the brain and the spinal cord from sudden, jerky movements which would cause these structures to bounce off the bony surfaces like the cranial cavity or the vertebral canal. And the third function is that it's also involved in the exchange of nutrients and waste between the blood and nerve tissue. There are 4 cerebrospinal fluid-filled cavities in the brain, and they are called ventricles, and they are located here. There is a lateral ventricle in each hemisphere, and these lateral ventricles are separated by a thin membrane called septum pellucidum. And then we have the third ventricle here, just above the hypothalamus, and the fourth ventricle here between the brainstem and the cerebellum. Cerebrospinal fluid is produced in the choroid plexuses, which are capillary networks in the walls of these ventricles. It's the ependymal cells of these capillaries which form the cerebrospinal fluid by filtration of blood plasma. Components to be filtered to form cerebrospinal fluid don't leak backwards here because of the tight junctions between these choroid plexus epithelial cells, or CPE cells. This is called the blood cerebrospinal fluid barrier, which allows certain substances to pass through to cerebrospinal fluid but not others. This is a way of protecting the brain and reducing the risk of contamination. Finally, to end the video, we're going to be talking about the circulation of cerebrospinal fluid. So, like we just mentioned, the cerebrospinal fluid is produced by the choroid plexus of each ventricle. It flows through the ventricles and into the subarachnoid space, and this is via the median and lateral apertures. Some of the cerebrospinal fluid flows through the central canal of the spinal cord. Then the cerebrospinal fluid flows through the subarachnoid space, and then it's later absorbed into the dural venous sinuses via the arachnoid villi. So that's all for this video on the cerebrospinal fluid. If you found this video useful, please leave a like or leave a comment below. If you'd like to request a certain video to be made, then just write the topic in the comments section below. Thanks for watching.
Oh my God. Just run. Review activity. Okay, so you guys can work on this one now. When I am going to, what is next one? You guys know all the things already. This is unit 8. Ready for exam?
We'll do our best, ma'am.
I know. Oh, so this is the exam. So Unit 7. Unit 7 is for actually for presentation. I give you the extended time for, okay. So after the video,
With Chewy, get your flea and tick.
then we have this one. Why they are not showing it there? Do you can see this review activity in your site? What I have to send you?
We can see it, ma'am.
You can see it
Yes.
in your
Yes,
site?
please.
Okay, so try that one. Okay, now. Okay. So right now we are done. Anybody have any question?
Ma'am, are we going to submit this again or just for review?
No, just do it here. This is, you doesn't have
For
to
review.
do just
Okay,
for
thank you,
review, or
ma'am.
you when for your study and other things, do this review. Okay. At the same time, yeah, I'm going to work for your project. Okay.
Okay, ma'am. Thank you.
Okay, ma'am. Thank you.
Okay.
Ms. Maroon, I have a question.
Yes.
So, in case of getting the CSF, for example, CSF sample, if there's a blood in the sample due to accidental puncture,
Yeah.
so wouldn't the blood interfere the sample results?
If it is the accidental, the traumatic, so that's why
Yes.
you doesn't collect the first one. First one can kind of more blood, and then you can see it's getting more clear. So you can use the microbiology and the CBC and other things later where there is no hemolysis, because traumatic means when you are going in, you puncture something. So first sample may be more hemolyzed sample. So that is used for the chemistry one.
Oh, okay.
Okay, but if it is a really something has been bleeding or something, you can have no choice. So it's
Yes.
going to come, all the samples are going to be
Yes.
look like the same thing.
Yes.
Okay.
Okay. Okay.
Yeah. What? What? You have the review in your lockdown. Yeah. You are studying. Afternoon, sweetheart. How are you?
I'm great. How are you?
Good, good, good. You got my email?
Okay, that's for Monday?
Yeah, yeah.
Okay, we have to talk to Bardell. I don't know what he wants to do. Because they have the sim lab there, right?
Yeah, but I have the final exam. What I can do if they doesn't
don't
have
worry,
the
don't worry. We'll
if they
figure out
doesn't have the
something.
space, then they have to get more space because
I
same
know.
thing is happening. The presentation versus this one and that one, but the final exam otherwise they can do it in the home.
Yeah. Yeah,
SimLab,
don't worry.
SimLab,
We're gonna work something out.
SimLab. That time they can use the lab from 9 to 11. 30 they can use the lab, SimLab people, and I can use the computer room.
Yeah, no problem. Yeah. We'll arrange something. Don't you worry. It's yours.
Okay. Thank you, dear.
Okay,
Thank
no
you.
problem.
Thank you. Okay, dear. Have a good. See you next week.
You too. Bye.
Hello, ma'am.
Yes, anybody is asking any question to me?
Yes, ma'am. We're missing the answer key for the activity.
You doesn't show the answer key? You doesn't have
No,
the
ma'am.
answer key?
Yes, ma'am.
Okay,
Thank you.
okay.
Yeah, and I noticed that you have it, but we don't have it.
Yeah, I have it.
Yeah,
They
thank you,
gave
ma'am.
it. Okay. Just give me a second. Finals. B. Let me go there now. 20. So you want only me to tell you the answers, or you want to send me?
It's up to you, ma'am. We can also review together.
Yeah.
Yeah.
So number 1.
Yeah, bilirubinuria is presence of bilirubin.
Okay, it's ABCD. You have to tool that. Tell me the number. Is answer is D.
Yeah. Okay.
Number 2.
G.
G.
Yeah. Yes. Number 3.
I.
I.
Good. Number 4.
K.
K.
Good. 5.
J.
K.
J. Yes. 6.
N.
N.
7.
A.
A.
8.
M.
M.
Okay. 9.
E.
E.
What?
E.
E.
Eagle.
E for eagle. Okay. 10.
B.
B.
Boy.
Yeah. B for boy. Okay. 11.
P.
P.
P for Peter. Yeah. 12.
O.
O. Orange.
Over.
13.
F.
F.
Yeah.
F.
Yeah. 14th.
L.
L as in Larry. Yeah.
Yeah.
15.
C.
C as in cat.
Cat. Yeah. A 16.
H.
H.
17.
Q.
Q.
Qwid. Okay. Next one. True and false. 1.
True.
True.
Okay.
Yeah.
2.
True.
True.
3.
True.
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 4.
True.
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 5.
True.
True.
6.
False.
False.
7.
False.
False.
8.
True.
True.
9.
True.
True.
10.
True.
True.
11.
False.
False.
12.
False, ma'am.
False.
13.
True.
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 14.
True.
True.
15.
False.
False.
16.
True.
True.
16.
True, mom. My answer is true. I'm not sure.
It's a false. It's going to be more alkaline.
False. It's more than 1. Yeah.
It's going to be alkaline.
Okay, ma'am. 17.
Yeah.
So it's false.
It's cloudy. This means there is infectious and yes, true. If they say it's
Yeah.
cloudy, means there
Yes,
is presence
true.
of bacteria. True.
Yes, true. The
Mm.
Oh, that's
UTI.
for 16, ma'am.
17.
17. Oh, 17 is true, yeah.
Yeah.
18 is true.
18 is
True.
true. The normal
Yes,
specific
true.
activity, 1%
Yes,
is,
true.
yeah.
Yeah.
19. 19.
False.
False.
True.
False.
False.
Okay.
False. Yeah.
False.
And 20.
False.
False.
Okay.
False. Is it false, ma'am?
It didn't say. Say 2020.
20.
It didn't give me the answer. So it's give the 20. Answer is 20.
Oh, okay.
I can show you my screen.
Okay, ma'am.
That's a mix up the
See,
system.
see, 2020.
Oh yeah, it's 20.
Amazing.
That's
D2L.
funny.
Cluster formed in the urinary bladder.
Yeah.
It's not formed in the urinary bladder. It passed down to the urinary bladder. It forms in the glomerulus in that area. It's false.
Yeah, false.
False. Yes, ma'am.
Yeah.
Okay, ma'am. Thanks.
Okay.
Thank you, miss.
Thank you.
You're welcome.
Okay, 15 minutes to go.
Yes, 15 minutes to go.
So the final is on Monday, right?
Yes, ma'am. Okay, everyone. Enjoy your weekend. Enjoy your study. I'll try if I can make little bit review for anything. I will send it later. Okay, sometimes. So you
Thank you.
guys, most of the thing is covered. Only the whatever you have learned for the body fluids today. Okay. But till if I can get some time, I will try to, because I have to work for your projects too. If I get some time, I will send it sometimes. Okay. I'll try my
Okay,
best.
thank you, Miss.
Okay,
Appreciate
Thank
it.
you,
Okay.
ma'am.
Have a
Appreciate
nice
it.
weekend.
Okay.
Okay,
Thank
thank you,
you very
Miss.
much. See you on Monday. Okay. Okay.
Yes,
Okay.
ma'am.
Okay. Thank
What
you.
time is the exam on Monday?
9:30, but be at 9, and then we'll continue after your break time. If you kind very fast, maybe we can squeeze the break time by 11:30. We can start the presentations. If
Okay.
not, we'll start at 12 and see how much it goes. Only the 4 people is going to present, right? It's 10 minutes present, 10,
Yeah.
10 minutes presentation. So it's not
Yeah.
more than 10. So we have to complete it by 1. Okay, Monday.
Okay.
Okay.
Thank you,
Okay.
Miss. Have a
Okay.
good
Thank
one.
you.
Nobody should miss on Monday. Okay.
Yes,
Okay,
ma'am.
thank
No
you.
choice.
No choice. Not even that. Now you can see how fast it's going. Then you are going to learn that whatever is in this model, right? So lab things. Then you till now your lab books needs to be updated. There is a huge marks on that. So there are a lot of things at the end. Okay. Okay. Bye
Okay.
bye. Take care.
Thank you.
Bye, ma'am.
Bye.
Bye
Thank
bye,
you.
Okay.
everyone. Thank you.
Stay
Have a
safe and
weekend.
healthy so that I doesn't like to hear in the morning. I have this problem. I have this problem. Okay.
Okay,
Okay.
ma'am.
We'll try
Okay,
our
Thank you.
Miss.
very
Try
best.
to
Bye,
Thank you.
stay healthy.
everyone.
Stay healthy. Okay.
Bye.
Okay.
Have a good
Okay. Bye.
weekend.
Bye.
Yeah.
Thank you.
We'll try.
I will study well for you. I am
Enjoy
working,
your
dear.
weekend, ma'am.
Anyway,
Thank
okay. Thank
you.
you. Thank you.
Thank
Thank you.
you,
Bye.
guys. Bye-bye
Bye.
now.